Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to do an introduction to some of the skeletal muscles of the face, and these are going to be muscles that are mainly involved in facial expression and also small movements of the face, such as chewing, movements of the lips and eyes, and so on and so forth. And we're also going to look at these muscles' origins, insertions, and actions. The first muscle that we're going to cover here is arguably the most complicated of all of them by far, and that is the epicranius. The epicranius is complicated because in addition to having left and right parts of them, it has both a frontal belly called the frontalis, which you see over here in front of the frontal bone, and then we have the occipitalis, which is the occipital belly, which lies superficial to the occipital bone. So it's composed of two different parts. And also notice between these two muscles we have this very large white tendon-like sheath, and this is called the epicranial aponeurosis. And anytime you see the term aponeurosis, it's basically a tendon, but instead of being a string-like tendon like a rope, it forms a sheet. And so this whole thing is something called the epicranial aponeurosis, or the Gallia aponeurotica. Those are two names for this tendon-like sheet, okay? And also because it's composed of both the frontalis muscle and the occipitalis muscle, this muscle is also called the occipitofrontalis, but you'll normally see it written as epicranius. All right, now when I talk about the origins, insertions, and actions, I'll generally default to looking at this table for you guys. However, for the epicranius, there's a few mistakes here in the origins and insertions. We're not going to look at it for this one, but I'll just talk about it here. So first, the occipitalis. The origin of this muscle is actually right down here where my mouse is. It's on the occipital bone, but it's a specific part called the occipital protuberance. Okay, that's the origin, and then the insertion is actually up here. Okay? The insertion is actually just the epicranial aponeurosis. In this table, they really call it the Gallia aponeurotica, but they're the same thing. So the insertion is up here, right where the muscle connects with the epicranial aponeurosis. And so because the insertion is always pulled toward the origin, what happens when the occipitalis contracts and shortens is this insertion is pulled downward. And so what we can imagine is this epicranial aponeurosis is sort of moved backwards. And it's not a very large amount, but overall, not just right here and not just right here, but all over, the epicranial aponeurosis moves backwards toward the occipital bone. Okay? Now, the frontalis belly of this muscle does something similar. This muscle has its origin right here. So the frontalis has its origin right here, and its origin is actually the epicranial aponeurosis. So the insertion of the occipitalis is the same as the origin of the frontalis. It's both the epicranial aponeurosis. So here's the origin. And then the insertion of the frontalis, there's actually two ways to think about it. One, this muscle actually will fuse and sort of interdigitate with some of the other muscles that are right here, such as the Orbicularis oculi. But most importantly, the insertion of this frontalis muscle is really the fascia that's underlying the skin of the forehead and also near the eyebrows. So let's think about this. If the frontalis shortens and contracts, it's going to pull the insertion, which is in this area, toward the origin. And so it's going to move upward. And so if you imagine the fascia underlying the skin moving upward, because that's being pulled on, your eyebrows are going to move upward. And so if your eyebrows move upward, if you do that particular motion, then also you'll tend to see the skin above the eyebrows kind of wrinkle a little bit, okay? And this is what happens when you raise your eyebrows. You usually, for most people, see wrinkles, several horizontal lines above the eyebrows between the hairline and the eyebrows, and it kind of crinkles up. All right? And there are some people who can raise one eyebrow independently of the other. This is because they have voluntary control of the frontalis muscles independently of each other. Some people, they contract in unison, and people don't have voluntary control over one independent of the other. But for people that can raise one eyebrow, they're contracting only one of the frontalis muscles, and most likely only one of the occipitalis muscles. But overall, what the epicranius does, as a whole, is it just moves the scalp in the backward direction. Okay, moves the scalp in the backward direction. And so what that ultimately does is raise the eyebrows up and crinkles the forehead. Okay? Let's now discuss the muscles of mastication. Mastication is also chewing. And there are two muscles. One of them is the temporalis muscle. This temporalis muscle, for the most part, lies on top of the temporal bone. And then the second one is the masseter. The masseter, we can see, lies sort of beneath the zygomatic process. Okay, so let's talk about both of these muscles, temporalis and masseter. So first we'll talk about the temporalis. We see here that it is a muscle of mastication. That means it's for chewing. The origin of the temporalis is the temporal fossa of the temporal bone. Now the temporalis is a convergent muscle. So if we look at this origin around here, we see all these fibers are sort of radiating inward toward the tendon, and they're going to converge at the insertion. And the insertion of the temporalis is the coronoid process of the mandible. Remember, the coronoid process is that one bump that sticks up off the mandible that's more anterior to the mandibular process. So the temporalis is going to insert on the coronoid process. Now, the temporalis actually has multiple fibers. It has three sets. It has anterior fibers, middle fibers, and posterior fibers. Okay? The anterior fibers of the temporalis are going to close the jaw, meaning it's going to elevate the mandible. Okay? Whereas the middle and the posterior fibers, they're actually going to retract the mandible and open the jaw. So, depending on which of these fibers, whether it be the anterior or middle and posterior, are acting on the mandible, you're either going to get closing of the jaw or opening of it. Now, the opening of the jaw is really a function mostly of the middle and posterior fibers of the temporalis. But the anterior fibers, which close the jaw by elevating the mandible, that's going to be synergistic with the function of the masseter. So the masseter is the second muscle of mastication. It's also going to close the jaw, meaning elevate the mandible, bring the mandible upwards, like when you push your teeth together. The origin of the masseter is the zygomatic arch. Okay, so if we look at this masseter, we see the zygomatic arch, part of the zygomatic process. Its origin is up here. So this is the angle of the mandible right here, and we see that the masseter is going to insert on this. And when the masseter contracts and shortens, here's the insertion. It's going to pull this up to the origin, and so you can imagine that we're going to be going in the upwards direction, and that's why the masseter closes the jaw, or we could say elevate the mandible. So to sum up these mastication muscles, the anterior fibers of the temporalis and the masseter elevate the mandible, they close the jaw, whereas the middle fibers and posterior fibers of the temporalis are going to open the jaw, meaning depress the mandible, bring the mandible down. All right, so next let's talk about the Orbicularis oculi and the Orbicularis oris. So the Orbicularis oculi is a circular muscle that surrounds the eyeball. So before we go any further, we need to understand what circular muscles do when they contract. Circular muscles have a hole in the center, obviously. When circular muscles contract, the hole actually shrinks, okay? When the circular muscles relax, the hole opens. So if the Orbicularis oculi contracts, this hole that we see in the center where we can actually see the eyeball, this hole should actually shrink, okay? And just in general, when the Orbicularis oculi contracts, we're going to have either squinting, depending on which part of the muscle, or lightly closing the eyelid. Okay, so in general, that hole is going to decrease in size. In one situation where you would see this muscle contract, specifically the orbital part, would be when you walk outside and you're looking pretty much directly into the sunlight. Right? We always squint whenever we get out in the sunlight because we want to protect our eyes, or if you're squinting to read something that you probably don't have any business reading without glasses, we squint. Both of those contractions are going to be of the Orbicularis oculi. All right? Very similar to that, the Orbicularis oris is a circular muscle that goes around the mouth. And when the Orbicularis oris contracts, it's going to decrease the size of this hole. And what does that do? Well, first of all, the Orbicularis oris has its origin at the maxilla and the mandible, depending on which part you're talking about. If it's the superior part of the Orbicularis oris, it's going to be the maxilla as the origin. If it's the inferior part of this muscle, the origin is going to be the mandible. And the insertion is going to be on the skin and superficial fascia of the lips. And so when this muscle contracts, you get certain facial expressions around the mouth. One of the best ones is actually going to be if you imagine kissing. So the position that you put your lips in when you kiss somebody is contraction of the Orbicularis oris. Or if you are going to try and whistle, that's going to involve contraction of the Orbicularis oris. So basically you're taking your mouth and lips and kind of forming a small O shape or a circle shape. That's contraction of this muscle. But oftentimes the Orbicularis oris is called the kissing muscle. Okay? Now, two more muscles here. Let's talk about the Zygomaticus. And we're really going to talk mostly about the Zygomaticus major. That's actually going to be this muscle right here. There's actually two parts of it. One's the Zygomaticus major and the other's the minor. What we see about the Zygomaticus major is that it has its origin here on the zygomatic bone. So here's our zygomatic bone, and it has its origin here. And then the insertion of the Zygomaticus major is again going to be the skin and superficial fascia, but at the angle of the mouth. So we actually see here that where this muscle inserts is actually going to be on the superficial fascia on sort of the corners of the mouth. Okay? And so if we imagine the insertion being pulled toward the origin, we're going to have smiling. So when you have an individual who is smiling, we know that the corners of the mouth kind of get pulled laterally, right? Maybe laterally and a little bit upwards, and that's because this muscle is pulling that insertion towards this origin in both a posterior direction and upwards a little bit. Okay? So for that reason, the Zygomaticus major specifically is often called the smiling muscle. And then there's one more muscle we're going to look at here, and that's the Sternocleidomastoid. So this muscle right here, this thicker muscle that sort of runs downward and a little bit anteriorly, this is your sternocleidomastoid. So the sternocleidomastoid, you can actually learn the origin and insertion of those basically with the name of the muscle. So the origin of this muscle is the mastoid process. So the mastoid process is going to be right up here. We know that that's sort of near the posterior aspect of the skull and inferior. And then it's going to insert on the sternum. And we see that information depicted right here. So origin at the mastoid process, and then the insertion is going to be on the sternum, and then also partially on the clavicle. And this muscle is going to do two things. So keep in mind we have a right one and we have a left one. So one of the functions of this muscle is going to be neck rotation. It's at least going to participate in that. And so for example, if the right sternocleidomastoid contracts independently of the left, so only the right one contracts, then we're going to have rotation of the neck toward the right. If we had the other sternocleidomastoid contract by itself, so the left sternocleidomastoid, we would have neck rotation to the left. Okay? There are some other muscles involved in that, but we're not going to talk about them here. However, if both of the sternocleidomastoid muscles contract simultaneously, then that's going to cause neck flexion. And so if you were to try to touch your chin to your sternum, at least the manubrium of your sternum, bring your head down forward, that's a neck flexion. That would be if both of the sternocleidomastoid muscles were contracting at the same time. So you can either have one going by itself, that would give you a rotation of the neck in that direction, or both of them, and that's a neck flexion. All right? So hopefully this video gave you a good understanding of the very important muscles of the face and the cranium, and then we took a look at their origins, insertions, and actions. Hopefully this gave you a good understanding. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you very much.